Hi, my name is Dr. Sara Arian. I'm a double board certified OBGYN and reproductive endocrinology and infertility specialist at Boston IVF. Today, I would like to go over some educational points as well as answers to some of the most commonly asked questions about menstrual cycles, ovulation, learning about your fertile window, and when to seek help from a fertility specialist. Having this information can help maximize and optimize your chances while trying to conceive. So let's start by reviewing menstrual cycles and what is the definition of a regular menstrual cycle. Menstrual cycles that are every 21 to 35 days apart are considered as regular menstrual cycles, meaning if your cycles fall within this range, anywhere between 21 to 35 days, that means that you're likely having regular cycles and likely to be ovulating regularly. Now, if your cycles are outside of this range, shorter than every 21 days apart or longer than 35 days, then likely cycles are irregular, and these individuals usually have lack of ovulation or anovulation, or if the ovulation does occur, it occurs sporadically, infrequently, and very irregular. And we highly recommend that these individuals seek help from a fertility specialist to undergo some evaluation. So what happens during a menstrual cycle? So at the beginning of the menstrual cycle, there's the start of the period, start of the bleed, what we consider as cycle day 1, which is the full flow bleed. And that's when the brain will secrete a hormone called FSH, which stands for follicle stimulating hormone. Now, the brain and the ovaries are continuously in communication through hormonal signals. And FSH reaches the ovaries through the bloodstream, and it will then start stimulating the ovaries to grow a follicle. A follicle is a fluid-filled sac that contains a microscopic egg. And as the follicle is growing, the egg within the follicle is also growing and becoming mature. At the same time, there is secretion of estrogen or estradiol from the follicle into the blood. And once this estrogen reaches a certain level, and once the follicle is large enough in size and the egg has become mature, that's when ovulation occurs. So at that time, there is secretion of another hormone called LH, which stands for luteinizing hormone from the brain. And as a result of this surge in LH or rise in LH, there is ovulation. So typically LH surge prompts ovulation to occur anywhere between 24 to 36 hours after the LH surge. Now, what happens during ovulation is that the walls of the follicle rupture and the egg within the follicle is then released. So ovulation is the release of the egg from the follicle, and the egg gets released into the peritoneal cavity where it can be picked up by a fallopian tube. And if there's sperm available and around, then the sperm and the egg can meet inside of the fallopian tube and fertilization can occur, an early embryo can develop. After this early embryo has developed, it will then travel back to the uterus where it can be implanted in the uterus. So it's important to also know about your fertile window and how to maximize and target intercourse to optimize your chances while trying to conceive. And in the setting of having regular menstrual cycles, we typically subtract 14 days, more or less, from the duration of the cycle to determine your fertile window. 14 days is the duration of the luteal phase, which usually remains consistent. And let's say for someone who has 28-day cycles, by subtracting 14, we know that ovulation is somewhere around cycle day 14. So we would like for you to have intercourse typically 5 days leading up to ovulation. And the reason for doing so is that we want to make sure that there's sperm around in the female genital reproductive tract so that once the egg is released through ovulation, the egg can become fertilized by the sperm. The sperm can usually stay viable in the female reproductive tract or genital tract for up to 5 days. However, the egg has a limited window of viability and fertilization. That's typically about 12 to 24 hours after the egg has been released. So that's why we want to make sure that there's sperm around during that time. And we typically encourage folks to have regular intercourse every 1 to 2 days, typically 5 days leading up to ovulation. Alternatively, some individuals check ovulation at home using ovulation predictor kits or OPKs, and these predictor kits typically detect LH surge. And once you get a positive OPK or ovulation predictor kit, we encourage having intercourse on that day and the next day to maximize your chances. Again, once the egg has been released and that window is closed, the egg can no longer be fertilized by the sperm. Now I would like to also go over when to seek help from a fertility specialist. So again, going back to menstrual cycles and the duration of menstrual cycles, in the setting of having regular menstrual cycles, for women who are younger than 35 years of age, if they have been trying for 12 months or longer, we encourage you to seek help from a fertility specialist. For women who are 35 years of age or above, this duration is shorter. So if you have been trying for 6 months or longer without success, we want to see you sooner than later. Women who are 40 years of age and above, we encourage you to seek help sooner than later without having to necessarily wait to start trying to conceive on your own. And the reason is because of the negative impacts of time and aging on a woman's egg quality as well as egg quantity. Now, women with irregular menstrual cycles, anytime there's concern for regular ovulation or lack of ovulation, any underlying fertility problems or factors, including tubal disease, risk factors for tubal factor and tubal blockage, anyone with any uterine issues or factors, including uterine fibroids, abnormal uterine bleeding, concerns for endometriosis, any hormonal disorders, including PCOS or polycystic ovarian syndrome, we encourage you to see us sooner than later. So in summary, if you have any of these issues, please do not hesitate to reach out to us. Our team of fertility experts are here for you and happy to help guide you throughout the process.